Hello again. I'm Joe McTurnan, AOPA's Director of Policy and Regulatory Affairs. Thanks for joining me today for another edition of AOPA's Take. I wanted to take the opportunity to remind you that the long-awaited update to the Medicare knee orthosis policy is officially in effect. For Medicare claims with a date of service on or after January 25th, 2026, Medicare will now cover certain knee orthoses when they are used to treat tibiofemoral osteoarthritis without the presence of ligamentous joint instability or a recent injury to or surgical procedure on the knee. This policy change comes after more than 2 years of collaborative work between AOPA and the Medicare DME-MAC contractors and will provide new treatment opportunities for your patients with osteoarthritis of the knee. Let's take just a minute to review what codes are included in the expanded coverage policy and the specific documentation that is required in the patient's medical record to support coverage. First, let's review the L codes that are eligible for coverage under the revised policy. They include L1843, L1844, L1845, L1846, L1851, and L1852, which describe off-the-shelf, custom-fitted, and custom-fabricated knee orthoses with either single upright or double upright designs that may be used to treat osteoarthritis by unloading the knee compartment and reducing pain. All of these codes are either currently subject to Medicare prior authorization or will be so when the prior authorization list is updated on April 13th, 2026. Next, let's discuss the coverage criteria outlined in the revised LCD. The four criteria which must all be met for Medicare coverage include: the beneficiary is ambulatory, the beneficiary is experiencing pain or reduction in their mobility and or function secondary to the medial or lateral tibiofemoral osteoarthritis. The knee orthosis provides either varus or valgus adjustment, and the beneficiary expresses a willingness to use the knee orthosis. Finally, let's review the documentation that must be present in the patient's medical record to support coverage. All of the following must be well documented in the patient's medical record to support Medicare coverage of knee orthoses used to treat tibiofemoral osteoarthritis: the beneficiary's ambulatory status, the beneficiary's pain symptoms or mobility and or functional reduction due to osteoarthritis, a physical examination of the beneficiary's affected knee or knees, an imaging report that describes arthritic changes evidenced on X-ray, CT scan, or MRI that is consistent with medial or lateral compartment tibiofemoral osteoarthritis, and once again, the beneficiary's willingness to use the knee orthosis. Whenever a Medicare policy is updated, there will always be an adjustment period, but the inclusion of Medicare coverage of knee orthoses used to treat osteoarthritis is a long-awaited and welcomed policy update. We look forward to working with AOPA members to fully understand and comply with the new coverage requirements. And as always, AOPA's Take, where you go when you need to know.